Okay, so hi everyone, my name is Bodhana and I'm a student at Centennial Collegiate Vocational Institute. And today I'll be unpacking the organ shortage crisis, which is an underrepresented global health issue that has implications in both developed and developing nations. So a little about me. I'm a senior grade 12 student from Guelph, Ontario, and I'm very passionate about biomedical innovation and equity. So I pursued these interests by competing at local and international business competitions, including DECA, JOT, and those run by the Lane School of Business at the University of Guelph. I've also served as the head of education at the youth-led nonprofit Pure Ontario. I'm currently the president of the athletics council at my school and play varsity basketball. On the side, I'm a freelance writer working with the Environmental Church Canada, and I enjoy camping and playing beach volleyball with family. So a quick overview of my presentation. So I'm going to be covering the relevance and the importance of the organ shortage crisis, socioeconomic barriers to access, introduction to organ trafficking, new developments in tissue engineering, and the role of education. So jumping right in, what is the organ shortage crisis? Well, it refers to the lack of compatible and accessible organ donors. In Canada, 223 of the 4,351 people requiring an organ transplant died prior to treatment in 2018. This statistic was also reflected in the United States, where 112,000 people on the national transplant waiting list could not receive an organ as of 2020. And in India, 500,000 people died due to no affordable transplant options in 2015. Organ transplants have extended the lifespans and improved the quality of life of patients living with a variety of ailments, including polycystic kidney disease, hepatitis, cystic fibrosis, heart defects, and physical injury to vital organs following accidents. Despite the 33% increase in transplants in Canada from 2009 to 2018, the deficit still continues. And I credit this to a variety of socioeconomic barriers, and I'm just going to be discussing a few of them. First off, there's the limited number of registered donors, and I think this is due to religious and cultural beliefs that these individuals have that prevent them from donating their organs after death. And on top of that, live donors have a higher risk of disease. And finally, patients are often uneducated on brain death and the ethics of live and deceased organs, which also makes them hesitant to donate. The second barrier I'll be discussing is that organ transplants are unaffordable for low-income patients in developing countries. And I think this infographic represents that well, because the cheapest option for an organ transplant in the US is the cornea transplant, and that itself is $30,000. And the average household income in India is only $1,670. So that's way above their budget. And it's almost nearly impossible for them to afford that. Continuing on with barriers, there's also the compatibility of donor recipient tissues. And compatibility is tested through blood and HLA typing. So we all know that there's 4 types of blood, and a lesser known fact. So HLA stands for human leukocyte antigens. There's around 33,500 different alleles. So all that variation makes finding a compatible match extremely difficult. And the last barrier is lengthening life expectancies. Over the last 20 years, there's been a 6-year increase in life expectancy, which ultimately leads to the growing prevalence of diseases. In Canada, over the last 10 years, there's been a 33% increase in end-stage kidney disease, which ultimately translates into a greater capacity for kidney donors, which we're unable to meet the demand for. And this is where organ trafficking comes into play. So organ trafficking is the illegal international trade of organs, and it accounts for 10% of organ transplant performed worldwide as a substitute to meet this additional demand. And this type of buying organs from people who traffic them is expensive, so then systematically acquire organs. And this is because donors are often poor, vulnerable populations from developing nations who are forced into selling their organs for small to no share of the profit. And recipients are often of the upper class of developed countries. And profits for this industry are estimated between 840 million and 1.7 billion annually. So in this map, you can see the distribution of donors versus recipients. And donors are, as you can see, are from more developing nations such as India, countries in South America, as well as Africa. And their annual income is much lower at only $500, while recipients are from developed nations such as Canada, the US, and Australia with a much, much higher annual income at $50,000. So since I'm personally interested in biomedical innovation and wrote a viewpoint article on tissue engineering, I thought I'd share what I learned. And the technology I researched is called SWIFT, or sacrificial writing into functional tissue, developed by the WISC Institute at Harvard University. And this technology enables iPSCs, or induced pluripotent stem cells. Let me just go on a tangent just to describe what they are. But they're basically adult stem cells which have been converted into embryonic stem cells so that they can differentiate into any possible type of cell that's in our body. So that's very versatile in terms of like building organs from scratch. So that's why this technology focuses on that particular type of stem cell. So it enables these stem cells, the clusters of these stem cells, otherwise known as encapsulations, to be vascularized with a 3D bioprinted endothelial circulatory network, where inside this cluster of cells, like bioink is printed on the inside in a sort of like pathway, so that once the bioink is removed, blood can now flow through it and keep the tissue alive. So that's basically the concept of it. And the current focus for this technology is on drug delivery and the synthesis of artificial ovaries. And although it's not currently there, in the next 15 years, they predict that it can meet growing demand, while rising arguably fewer ethical concerns than organ transplants, because it has a limited impact on the health of the donor. And there's no discussion of the moral status of embryos, because as I said, like embryonic stem cells can be used, but there's also the discussion of to harvest them, you'd have to kill an embryo, and is it alive? So there's that debate to it. So that eliminates that. Using IPCs eliminates that. Okay, so this image is just illustrating on the left is an encapsulation that's not been vascularized. So at 12 hours later, it's actually dying, and that's the right. The right, there's a vascularized encapsulation, and it's very much alive. So that's why scientists are targeting this technology, because it's able to keep these tissues alive for longer. But there's also much work to be done. And finally, the role of education. Education is a gift to patients because they can have a holistic understanding of organ donation so that they can disassemble their own stigma and personal concerns on their own accord. And how we can make this happen is training healthcare professionals to start these difficult conversations, build infrastructure that streamlines transport of organs for better accessibility, allocate greater budget and priority to tissue engineering research, and finally, integrating education early in primary and secondary school curriculums. And finally, to recap, first and foremost, organ transplants are gifts of life, and barriers to them include the lack of donors, affordability, compatibility, and increase in the prevalence of disease. Poor trafficking skews donor and recipient distribution, and Swift and other like tissue engineering technologies are trying this demand with artificial organoids. And what you can do to combat this issue is just educate yourself and others around you to disassemble your own stigma and be more supportive of organ donation. So here are my references in case you want to learn a little bit more. And I just wanted to say a big thank you to Jed Lauren, who helped me with my viewpoint article, and of course to you all for listening. And if you would like to contact me or read my viewpoint article, I have attached my email and LinkedIn URL on the slide, as well as the link to my article. So that's it. Thank you so much.